Hi there, I'm medical malpractice lawyer John McKiggan. If you have to undergo a medical procedure, you need to know what informed consent is and what impact it may have on your medical malpractice claim. Consent to medical treatment. Everyone has the right to decide what can be done with his or her own body. This is the legal principle called autonomy. Because of this legal right, your doctors need your permission, the legal term is consent, before they can treat you. So what is informed consent? You can only give valid permission if you're provided with all the information that's necessary to make a decision about the proposed medical treatment. It's not acceptable if your doctor simply asks if he or she has your permission to perform a medical procedure. You must be able to understand the reasonable and foreseeable consequences of giving permission, consent, or not giving permission for the medical procedure. It's generally accepted that in order to provide proper permission for medical treatment, your doctor must explain, number one, the nature of the proposed medical procedure, number two, the reasonable alternatives to the proposed medical procedure, and number three, the relevant risks, benefits, and uncertainties related to each alternative. Your permission, or consent, may be expressed in words or implied by your actions. For example, when you're undergoing a surgical procedure, your doctor will usually get you to sign a consent form as part of the consent process to confirm your permission to perform the medical procedure. Any medical procedure that's performed without proper informed consent is deemed to be an assault. The doctor who performed the medical procedure will be responsible for any injury suffered by the patient as a result of that medical procedure. Unfortunately, it's usually very difficult to win medical malpractice claims involving allegations of informed consent. Often the question is whether the risks were properly explained to the patient, and it boils down to the doctor's word against the patient. In most of the reported medical malpractice cases across Canada, judges and juries tend to favor the doctor's word unless there's clear evidence to support the patient's version of events. Therefore, it's really important to document the consent process by making notes of any discussions that you have with your doctor before you undergo a medical procedure. Particularly, any discussion that you have with your doctor about the risks, benefits, and alternatives of the proposed medical procedure. If you want more information about medical malpractice claims, call us for your free copy of Health Scare, the Consumer's Guide to Medical Malpractice Claims. This public legal education guide contains everything you need to know to protect your rights if you think you or a family member has been a victim of medical malpractice. The book's for sale on Amazon, but we will send you a copy at no charge if you call us at 902-423-2050 or go to www.healthscarebook.ca.